Around a third of today's total spend up went to health. $11 billion is New Zealand's biggest ever investment in the sector, and it'll be used to set up our new health system.
An election promise was also met with a boost to dental grants, and Pharmac gets a cash injection of $191 million, although it's not as much as advocates wanted. Political reporter Imogen Wells has more.
For years, they've been calling for more Pharmac funding, and today, the short straw's been drawn once again.
Get on and fund it, because if you don't, people will die.
What they wanted was $300 million more per year for our medicine buyer. What they got was $191 over 2 years. And while it's the biggest boost Pharmac's seen, advocates are reeling.
I'm just lost for words. It's a decision politicians are now making for people to die.
It gives yet another boost to Pharmac under this government. You know, remembering that under the previous government, Pharmac funding was frozen for 3 years.
Pharmac's crumbs play into the overall $13.2 billion budget pie for our health sector. Over the next 4 years, $11 billion will be spent on our new health system, so scrapping DHBs and clearing their debt. There's $1.3 billion to improve hospital infrastructure and $76 million to fund both workforce training and an extra 1,800 jobs.
Well, this is going to make a massive difference to every New Zealander in terms of the health care that they get.
We have a massive blowout in spending, and I don't think people are internalising the reality of what is happening here. That is not good for New Zealand.
There's a lot more coming for those on the ground. $100 million to boost community health care, and GPs in high-need areas are getting $86 million to expand their services to get more people through their doors. But because of staff shortages, one doctor doubts that'll happen.
We are now at least 15 years behind where we should be in terms of growing our workforce.
The government also finally delivered on an election promise, boosting dental grants for low-income families from $300 a year to $1,000.
I'd say that there's hundreds of thousands of Kiwis that will benefit from this initiative. Certainly still an ambulance at the bottom of the cliff, but it's an ambulance we haven't had.
Health was always going to be the big spend this year, but the government had to balance the reform, which will take years, with giving Kiwis changes that they'll immediately see, like extended GP hours. But the glaring gap here was the Pharmac spend, which yet again has fallen way short. Imogen Wells, Newshub.